Hi, dear friends. I am Dr. Rajasekhar M. What is perianal Crohn's disease? First, let us know what is Crohn's disease. Nowadays, this disease is being identified, and the incidence is increasing nowadays in India. About say 30-40 years back, autoimmune diseases were not that common in Indian subcontinent. We used to consider it as more of a Western disease. Now we are seeing all sorts of autoimmune diseases also. In that, Crohn's disease falls into one of that. Autoimmune diseases are our immune system. It's like a policing, which will be looking out for all the invading organisms. It may be bacteria, it may be virus, it may be fungus, organisms coming from outside. It will be clearing every day. Especially during night, the immune system will be active and will clearing all the infections. Sometimes they go out of their way, and instead of killing or attacking the invading bacteria or fungus or virus, it will start attacking our own cells. It gets confused that the normal tissues are also something as an enemy, and they start attacking. In that, when it attacks the intestinal wall, what we call as lining wall, we call it as IBD. IBD is inflammatory bowel disease. So in that there are two types. One is called Crohn's disease, the other one is called ulcerative colitis. So Crohn's disease is one of those autoimmune diseases where our own immune system is overreactive and attacking our own intestines. It can affect from mouth to anal canal, any part of the gastrointestinal system. Whereas ulcerative colitis affects only the large intestine or colon. So Crohn's disease, what are the symptoms? Because it can affect any part of our gastrointestinal system, the symptoms depend on where it has affected. In general, these diseases cause one sort of what we call as malaise, means we are feeling a little weak, tired, mild, feverish feeling, and abdominal symptoms, feeling of indigestion, bloating, difficulty in passing stools, that sort of vague abdominal symptoms. And when it increases and when it becomes more, the Crohn's disease can cause two issues. Either it can cause the narrowing of the intestinal tract and cause obstruction, or it can cause loose motions, or it can cause the ulcerations, bleeding, that sort of things, which is a little rare in Crohn's disease. So the Crohn's disease occurs in patches. It can have a small patch in the small intestine, one more at the large intestine, one at the anal canal. So the perianal Crohn's disease affects around the anal canal, causing different symptoms. So what it causes is, commonly they call what is called a fistula. There are small holes around the anus discharging pus. So regular fistulas, what we call as chronic non-specific fistulas caused by infections of the glands, they are a little different from Crohn's disease fistulas. So we have to make a differentiate between these two, because normal non-specific fistulas, we do surgeries and clear them, and they are likely to completely get cleared. In Crohn's disease, if you treat only the fistula, it will not heal, because the problem is from within. The body is attacking. So we have medical treatment for Crohn's disease. So there are different types of medicines are available nowadays. Very good medicines are available. So anti-inflammatory agents, immunosuppressants, there are so many different groups of medicines. So to suppress that inflammation and cure or at least make the Crohn's disease less. So come under control. So whenever we require surgery for Crohn's disease, we do minimal surgeries. If there is collection of pus, just open, remove the pus. We don't do very extensive surgeries because wound healing will be a problem. So do minimal surgeries for Crohn's disease and then treat medically. They will respond well. There are some newer methods of treatment are also available nowadays. So we have special interest in those cases, because ours is a tertiary care unit in colorectal diseases, especially anorectal diseases. So any complex fistulas, then any recurrent fistulas, which most of them can be from Crohn's disease, tuberculosis, we do a very methodical examination, investigation, rule out one by one, and then treat the specific cause, so that the recurrences should be minimized and the complications should be almost nil. So Crohn's disease, this more or less it is fistulas, small holes causing a lot of pus coming out from that, and the anal canal can get distorted, all that. So when it's early detection and early treatment will prevent the formation of deformities of the anal canal and lot of issues which it causes. Now coming to the dietary, this one has got diet any role in the Crohn's disease? There is no specific this one so far. They have come out saying that if you eat this you will get, or if you don't eat this you will get cured. So there is no specific role. If somebody notices during their food If you notice that this sort of thing when I am taking, it's increasing, you can avoid that rather than simply following, because a list of things if you give, you avoid everything and you develop nutritional deficiency. So only thing some people in Western countries, they say milk, avoid the milk and milk products, but in the Indian context we have not seen that per se milk directly related to the Crohn's disease or its symptoms. So diet doesn't have much role in that. So don't do unnecessarily restricted dieting and cause more nutritional deficiencies, because Crohn's disease itself can cause nutritional deficiencies when it affects the intestines and all that. So have a proper balanced nutritious diet. That is more important.